Hey everyone, it's Nurse Dani, and I'm here today with Dr. Knapp from Southbridge Clinic at Riverton Hospital. He is an OB/GYN, and that's actually what we're here to talk about today is what does an OB do, and what doctor should you go to for certain things, and what happens at prenatal appointments. If you've never had a baby before, then you can kind of get a little nervous wondering what's going to happen when you go. You're already excited and have so many emotions about pregnancy anyway. And so he's here to answer all those questions for us today. Dr. Knapp, tell us a little bit about yourself.
Yeah, so I'm from Indiana. So I'm not from here. I grew up there, went to college there, went to medical school at Northwestern Chicago, and then started residency in North Carolina, and then finished the last 3 years of residency here at the University of Utah.
And out of all those places, you like Utah the most, and so 100%. That's why you stayed.
It's the best snow on earth. That's right.
Great. So let's say that I am thinking about having a baby. And, I may have heard somewhere that, I have thyroid problems and I have a few other things going on. I'm thinking, maybe I should talk to someone about this before I get pregnant to make sure I'm, as healthy as possible.
Right.
Should I actually make an appointment with an OB before I get pregnant?
Yeah. So I think it's always helpful, and you will never go wrong by doing that. Meeting with an obstetrician before pregnancy is really helpful to go through your medical history, any surgery you've had, medications you're taking, because almost all of those are going to be impacted in some way by the pregnancy or impact the health of the pregnancy. Even in healthy women, it's really helpful to talk about things like your periods. When and how should you try if you want to be aggressive about trying.
You've had irregular periods. This is a chance to learn some education about timing things right. And maybe we need to do something to get those regular.
Exactly. Some patients struggle with things like infertility. And the first step to identifying that can be meeting, even when you're first planning to try, so that you know, okay, it's okay for me to try, or maybe we ought to do a little bit of investigation to figure out if there's a problem that might come about.
That might eliminate some of the guesswork that happens if you don't see a doctor and you've been trying for 6 months and you're not pregnant. You didn't know that the fact that your cycles are coming every 45 days is abnormal kind of thing.
Right. Exactly.
So it's really helpful to have a preconception appointment. What kinds of things could someone expect to talk about then? You said health history. If there's, if I was... weight is kind of a touchy subject, but is that something that you would counsel someone on prior to getting pregnant, because that can impact the well-being of the pregnancy?
It can. When it comes to pregnancy, a lot of outcomes that we think about in pregnancy can be affected by your health before the pregnancy. You mentioned weight. When we think about how to approach weight before pregnancy and during pregnancy, the approach is a little bit different. Before pregnancy, there are a lot of things people can do, either less aggressive or more aggressive, to try and achieve a healthy weight. In pregnancy, we can't be so aggressive. We have to be careful with how we take in calories, how we limit calories, how we modify our diet to get the appropriate
how hard
nutrition.
You exercise.
Exactly, yeah. The reality is, for a lot of healthy habits that we think about before pregnancy, you can actually continue those during pregnancy. And for most people, that's actually very much recommended. But a lot of people just don't know how to take that first step to deciding, well, what can I change? What can't I change? And when you're already thinking about a pregnancy, it can be even harder to decide, okay, what's healthy and what's not.
And what about, I can see another benefit of having a preconception appointment where you talk about, taking prenatal vitamins and what should I eat and not eat, or medications I am on, or alcohol consumption, because those are all things that play into, they could affect a very early pregnancy if you got pregnant and you didn't know it. Exactly.
The biggest problem when we think about unplanned pregnancies is just that. It's that you're pregnant before you know it, and then all of a sudden you have to think back,
what did I was doing? Oh my gosh, I got sick. I took some NyQuil the other night. Oh my heck, yeah.
Exactly. The reality is the vast majority of those things are a lot of fears that we can waylay at a visit that happens before the pregnancy. We can talk about things that you should avoid. There's only a small number of medications you have to avoid. For the most part, you can live your life just like you were when you're not pregnant, but it's a really good time to talk about those things, know what you're fearful of, know what other people are saying, so that you can clarify all those things and feel comfortable with pursuing a pregnancy.
I was thinking about a time when, because I worked on labor and delivery forever, we talked about that, and even knowing everything I knew, it's the second you become pregnant, you're irrational.
Yeah, we all are.
And I remember a nurse that I worked with came to work crying one night, and she was like, I need to talk to a doctor. The first one who comes in, tell me, because I need to go ask him if it's okay that I inhaled a lot of smoke because I burned sausage at my house today.
Yeah.
And so it's like all those kinds of things, you start thinking about everything you've done, everything you've eaten, and you want to know, is it safe or not? So a preconception appointment is a good time to address all those
100%.
things. Awesome. Okay, and infertility, we talked about that. That's a good thing to address. Preconception can help us determine what's normal and what's not for us, so we don't waste 6 months trying when we didn't need to. Okay, so now let's say that I'm pregnant. I'm so excited. I just saw that positive result, and you told me when I went to my preconception appointment that I should wait to test until after a missed period. So I totally waited, got a positive, and now I just don't know when to make that first prenatal appointment.
Yeah.
When should I?
Yeah, so you can make it at any time. The best time is typically within the first trimester. Some people will see you as early as 6 to 8 weeks. That's about the earliest that you can see a heartbeat on an ultrasound, which is sort of the first test of viability. But even being seen as late as 10 or 12 weeks is not unreasonable. For people who aren't having many problems, things like morning sickness or bleeding are examples of those. For people who feel pretty well, there's no right time. For people having problems, if you have any bleeding or you're having a lot of morning sickness or new headaches or fatigue or things that you just don't quite know how to think about, it's never wrong to come in earlier. And I'll have a lot of my patients come in sooner rather than later so that we can address those things.
So if I called and made an appointment and I was going to be about 10 weeks along based on my guesstimate, but something was going on sooner, then it could be rescheduled.
100%.
Okay.
Yes.
Good to know. So at that first prenatal appointment, I imagine a lot happens. What can someone expect?
Yeah. So for patients that I've never met before, that's the time when I go through things like past pregnancies they've ever had, their medical history, surgeries they've ever had, medications they're taking, anything in their family history that might clue me into something I should be worried about.
Because you're trying to take a survey of the overall field to determine what the woman's at risk for. Right?
Exactly. It's also a time to talk about some of the symptoms they've been having. Inevitably, most patients will feel the pregnancy in some way. Either they just feel difference in terms of their cravings or morning sickness, bleeding, things like that. So it's a time to talk about all those things, which is a lot. Yeah. There's a lot to talk about. But you're exactly right. It's a time for me to screen who they are as a person, who they are as a patient, and focus on things that we can change or things that we can do to optimize their pregnancy from the very beginning, or just help them feel better, because pregnancy can be miserable sometimes.
Yeah. And so is there anything a woman can do to prepare for that appointment to make it a little bit easier, like write down all of her medications or questions she's had or anything like that?
I think for most women that I meet, their health history is not particularly complicated. Most women are young and healthy, haven't had much in the way of medical problems or surgeries or medications. Questions, I think, is really important. A lot of patients will come to me and they'll think, oh my gosh, I had all these questions and now I can't remember any of them. So just write them down. That's never wrong. Sometimes we can't address all of them, but that's why we see patients more than once in the pregnancy. Yeah. And if I hear all of them and I get a sense of who they are, then we can focus on the most important things first. And then in a couple weeks, if I see you back or when I see you back, we can talk about more of those things.
I love how you said that you're not just trying to assess the risk and the history, but you want to get to know the person. Because when someone calls and is asking questions or is concerned and you know that person, then you're going to know if, like, it's going to really clue you into whether or not something's serious. If this person normally doesn't ask any questions, they're kind of timid and shy, and now they're calling you and asking certain things. Yeah. Or if someone's just like, they ask a lot of questions, you know that about them, and you know that it's important to give them all the information they need to feel calm about things. Right. I love that. So, is there any blood work, or how do you establish like a due date?
That's a great question. It's not straightforward. But when we think about establishing a due date, the first way is using when your last period was. And there's a calculator you can use to help do this. Usually, patients will have an ultrasound sometime in the first trimester that confirms that. If they're very similar, it'll stay the same for the rest of the pregnancy. If they're different enough, then we typically base the due date off of the ultrasound because ultrasounds tend to be more accurate.
Or if like someone's having irregular periods or doesn't remember.
Exactly. When it comes to thinking about due dates, a lot of patients will ask, especially later on in the pregnancy, well, I've had several ultrasounds, and they always say, well, I'm measuring 3 days ahead or 2 weeks behind or so on and so forth. That's just a way of determining or reporting size. So what's really important, and it's a good question to ask at the very beginning, is what is my due date? Because once that's been determined, for the vast majority of people, it shouldn't ever change. And it's the one number that never changes. You're going to be a different gestational age every single day. But if you always remember your due date, you'll always be able to determine that.
I don't know a pregnant woman that doesn't know her due date.
Yeah. Some don't, but it's an easy thing to remember, which is nice.
Yeah, because you're counting down the days.
100%.
Okay, so are there things that you should eat or shouldn't eat during pregnancy?
For the most part, you can eat just about the same things that you were eating before pregnancy. There are some sort of pieces or pearls to think about. One is calories. So in general, basic calories. We know that pregnant women need more calories than non-pregnant women.
And at what point in the pregnancy does that start?
Even from very early on. The further along you are, say if you were to say someone requires a 2,000 calorie diet at the beginning of pregnancy, by the second trimester they might require an extra 200 calories, and by the third trimester an extra 400 calories. People who expend more energy doing more exercise are going to need more. People who don't expend as much energy are going to need a little bit less. You can calculate this, but the general idea is that you need a little bit more as opposed to a little bit less.
And if you're having nausea, you probably, I remember wanting to snack a lot because if you get an empty stomach, then you start to feel sick. So just by eating snacks, you're gonna get those extra 100%, calories.
100%. A common adage is you're eating for two. You should be careful with that because 200 calories is not quite as much as a whole second meal.
Yeah.
This is where some people can get themselves into trouble when thinking too hard about it. We always think about different vitamins and nutrients. What's a good prenatal vitamin is a really common question that I have. In point of fact, the best vitamins and minerals that you can get are the ones in your diet. Ones that you get in fresh fruits and vegetables, ones that you get in terms of whole grains, eating a variety of proteins, things like that. A good prenatal vitamin is one that has a couple of things. The most important one is folic acid. And you can ask your OBGYN what the exact amounts are. They should be telling you at least 400 micrograms in a day.
What about additional supplements? Is there anything else you should be taking besides a prenatal vitamin?
Yeah, so in general, most prenatal vitamins are going to have most of what you need. Folic acid, calcium, iron, vitamin D, iodine. Those are sort of the ones that are most strongly recommended and most evidence-based. We do know, at least in some sense, that you shouldn't try and supplement too much because getting vitamins and minerals in excess can cause problems in some ways as not getting enough. And with a typical American diet, the worry is not so much that you're not getting enough, but that you might get too much. And eating and getting your minerals and vitamins in your diet will help. That's sort of a natural way to help get the right amount without overdoing it.
I love that. That's great advice. What about sushi and deli meat and hot dogs?
Yeah.
Because I hear pregnant women all the time say, I'm craving a hot dog, but I heard I'm not supposed to eat one.
Yeah, so when it comes to eating, the key here is sort of eating raw or processed meats or foods. When you read about all the bad types of infections you can get in pregnancy or that are specific to pregnancy, many of them are associated with foods that are more susceptible to carrying those types of bacteria that you might get.
And pregnant women are already more susceptible to illness because the immune system is
down
a little bit.
Exactly. For raw fish, for example, the key is eating very, very fresh raw fish. Most people don't know where raw fish comes from or how it's processed, and therein lies some of the fear associated with eating it. The reality is if you have a place that you know is reliable and you're craving sushi on occasion, go have some sushi. The likelihood of acquiring an illness from that is still overall very low. The same is true for things like processed meats. They're processed in a way that makes the food survive a while, and therefore
like preservatives.
Exactly. And organisms that are able to survive that are, in theory, ones that are much more fastidious and can cause much more harm. You should just be mindful, I think, of where you're getting your food. Things that are fresh, things that don't have a lot of additives in them, things that haven't been sitting out for days and days and days, The
same applies to food prep at home.
Exactly, yeah. It's exactly what you should be, what most people do outside of pregnancy. We just think a little bit more carefully because you're not only eating for yourself, but you're thinking about the health of someone else too.
Yeah, isn't it interesting that we don't often care enough about our own health to watch for that we do during pregnancy?
Yeah.
You should care all the time about your
Right.
health.
Right.
And after you've had the baby, I would argue too that as a mother, you need to be optimally healthy to keep up with your kids.
100%. Yes.
Okay, so moving forward, kind of out of the first trimester, what other appointments, like how often do you see an OB during pregnancy?
Yeah. So the first one is certainly the most important. There are a couple of big times in the pregnancy that we think about. The second is generally around the 20-week mark, so about halfway through the pregnancy.
Will I see a doctor between my first and between the 20-week? Like how often do you usually go?
Usually in the first trimester, and about half or most of the second trimester, you're going to be seen about monthly. Some people space that out a little bit if things are going really well or if you happen to be leaving town. Some people need to be seen more frequently if they're having issues with, say, morning sickness or bleeding or things like that. You and your doctor can kind of determine the optimal number of times that you need to be seen. But usually monthly up until about 30 weeks is a good sort of beginning scaffold.
Okay. So you're saying 20 weeks. What happens at that point?
Yeah, so that's when a really fun ultrasound tends to happen. Everyone's recommended to have one ultrasound in the pregnancy at least, and the most important one is this one at 20 weeks. This is where we look at the baby's size, we look at the placenta, we look at all of the baby in detail to see if there's any signs of birth defects or other problems that we need to know about. It's a really fun one. It takes about an hour.
And I'm showing up expecting to leave with the gender so I can go do my gender reveal, but it's so much more than that.
Yeah, exactly. When I get that report, I'm interested in all of those things. Sometimes they don't even put the gender, especially if they can't even see it.
So speaking of being able to see the gender, what's the earliest you can accurately determine the gender of the baby by ultrasound?
By ultrasound, it depends. 20 weeks is a nice, reliable time. When you have ultrasounds done a little bit earlier, say at 12 weeks for certain types of genetic screening, you can see very early signs, but it's on the order of seeing the angle of a very tiny part of the baby. That is very subjective. So you can make sort of suppositions at that point, but it isn't really until 20 weeks or so that you really get a good shot.
So don't do the gender reveal party until then.
I would not.
It could change.
I would not. Unless you do a specific type of genetic testing that gives you that information very reliably, then
like
I would
a blood
wait.
test.
Exactly.
Yeah. Okay.
Yeah.
So if I did a blood test, like anytime after 10 weeks, and it said I was having a boy, then I can
Pretty
feel
reliable.
good about that.
Yes.
Okay, so beyond 20 weeks, beyond the ultrasound, what other appointments kind of have like some highlights? They're all important. And speaking of that, for the appointments that don't have the highlights, what is the point of them?
Yeah.
What are you looking at, and why are they important too? Because they absolutely are.
Yeah, that's a great question. When someone comes in, we do a couple of things every single visit. One is we ask if there are any questions. And this is always a good time to bring up the questions that you have. Sometimes people don't know how to reach out to their office, or they think, oh, this is a question I want answered, but I don't think I need to have it answered right now. All of those appointments are great times for that. We check weight. So when we're following along for how much weight am I gaining, is it appropriate for the pregnancy, should I be worried? We check blood pressure. Blood pressure in pregnancy can pose a really important problem that shouldn't be missed. We always check urine every single time someone gives us a sample of urine, because we're screening for blood pressure related problems in pregnancy. And then we check on the baby. Usually this involves checking the heartbeat, making sure baby is still doing well, and measuring the size of your abdomen to make sure the baby is growing as appropriately.
How does the size of a woman's belly indicate the growth of the baby?
Yeah, so it's a kind of a neat convenience or a neat coincidence in that the distance from the pubic bone to the top of the uterus after about 20 weeks or so typically matches the gestational age.
Isn't that such a crazy thing?
It's crazy. It's wild.
It is
it's
neat.
wild.
It is so neat. I love that.
Yeah.
Okay, so if someone's off from that, say I came in at 24 weeks and I'm measuring like 28. What can I expect, and what might you be thinking?
Yeah. In general, when there's a discordance between the size of the uterus and how far along you are, different things can affect that. One can be, and what most people would be worried about, is the health of the baby. And so we can always get an ultrasound to confirm that. An ultrasound is the much better marker of how well or how big a baby is.
So maybe you're bigger because you have a lot of fluid.
Exactly.
Or maybe you're small. Like maybe it's just the way you carry the baby or something.
Exactly. Some people are heavier in pregnancy. Some people are smaller in pregnancy. Some babies are bigger. Some babies are smaller. There's all sorts of different things that affect this measurement. And that's why it's only sort of an approximation.
Mm-hmm. So eliminate all the variables and cut to the chase and see what's really going on.
Yes.
So if a baby is abnormally small, what might potential causes of that be?
That is a long list. But we think about, are there concerns from sort of a genetic perspective? We always talk about genetic screening in pregnancy. So there are certain genetic conditions that can lead to that. Certain birth defects can lead to a baby's measurement being small, because the measurement, or a growth measurement, is a combination of several measurements of structure of the baby. So if one of those is larger or smaller because of a birth defect, that can also lead to this. There are a number of maternal health problems that can affect the growth of babies. High blood pressure is a really common example of this. So people who have high blood pressure outside of pregnancy are more likely to have babies that are smaller. Some people worry about not eating enough or nutritional deficiencies. It turns out it's really hard to do that. You have to really starve yourself to cause.
Because the baby's a parasite and
Exactly.
they'll take it from you.
Exactly. So in general, when we think about all of the things that can lead to babies being small, we think about maternal problems, baby problems.
Placental issues?
Mm-hmm, exactly.
Yeah. So what about a baby that's abnormally large?
That's another hard one. Or not, I shouldn't say hard. The biggest thing we think about is diabetes in pregnancy. Every single person should be screened for diabetes in pregnancy.
And when does that screening happen?
Usually 24 to 28 weeks.
Mm.
Yeah.
And how is a woman screened for that?
Yeah, the basic idea is we give a woman a load of sugar. 50 grams is sort of the standard dose, which is about 2 cans of cola. And then you check their blood sugar an hour later. We know that for some women in pregnancy, the ability for you to take in that sugar out of your blood is harder as a consequence of substances that the placenta makes. And so we test that by giving you a load of sugar and seeing what happens. For people who have elevated blood sugar, on that first test, we confirm it with one where you're fasting. We give you a little bit more and draw your blood several times.
Do you have any tips or suggestions for women when they take that so that they don't get really sick? Because having done them myself, I remember thinking like, oh yeah, I can totally do this. I worked a 2 to 2 shift that day, like 2 p.m. to 2 a.m. So I went to the lab and did it in the morning, and I was like, I regret that because I felt sick for a while after.
Yes. I think the first tip is you don't have to fast. Many people think that if you have fasted, you'll get a better result. If having a little bit of food in your stomach before you drink this bottle of sugar is helpful, by all means.
Stick to like protein, like it doesn't matter.
Yeah, it doesn't really matter. Some people worry that if you have a meal shortly before this particular test that you might have a false positive. The reality is if you have a positive result, you're going to confirm that with the 3-hour test. It's less fun and requires a little bit more work, which is why we try and start with the 1 hour first. But I would rather have a false positive that we then prove is normal.
Right.
Some patients will come in and just in that moment they'll think, I just don't know if I can stomach this right now. That's okay. We can give you the bottle to take with you. You just take it home on a day when you are feeling well or on a day that makes sense where you can take the time to do it. And you're prepped for it, exactly. Yeah. Then you can do it, and once we see that result, then we can get in touch with you. That's why we can do this in that 4-week time period between 24 and 28 weeks. There's not one hard time.
Okay, that's good to know. What else happens around 28 weeks? Is there anything else like Rogaine shots? I am A negative, and so that's something that I know a lot about, but people who don't have negative blood type or have been pregnant before may not know. Tell us more about that. Yeah.
So in general, at 28 weeks, apart from the diabetes screen, that's when we give at least one vaccine, the Tdap vaccine for whooping cough. Helps provide immunity for the baby until the baby can be vaccinated at like 6 months of life.
And this happens in every pregnancy, regardless
every single one.
When you were pregnant last.
Exactly.
Because it's for the baby, not you.
Exactly. That's right. If the flu shot is in season, then we always recommend getting that. And now is the time when I'm giving a lot of patients both of them at the same time.
Say if I'm coming to you for like my first prenatal visit, and I'm somewhere in the first trimester, can I get my flu shot then too?
100%.
Any time in pregnancy, flu shot. Okay.
Exactly. We draw your blood for the diabetes screen, and so we include in that blood work a screen for anemia. Anemia is very common in pregnancy, either as a consequence of normal changes in the body during pregnancy or as a consequence of iron deficiency. Your body needs more iron to support a pregnancy. You mentioned being Rh negative, so for people who have that negative after the letters of their blood type, you're at risk for a very significant problem that we have actually largely mitigated with RhoGAM. The basic idea is that when you have negative blood, Rh negative blood, that you can make antibodies, or your immune system can respond to red blood cells with the positive type. Moms who are Rh negative who have partners that are positive, your baby can be that, or can have that quality. And when your body as a mom mounts the immune system response to baby's blood, that can cause anemia, which is a big problem.
In the baby. In
the baby, that's right.
Yeah.
That's right. So we prevent that, or we try to prevent that. So in anyone who's Rh negative, the problem happens when the mom sees red blood cells from the baby. This can happen with any kind of bleeding, and most commonly happens at the time of delivery. And so we give you this RhoGAM shot to help sort of trick the immune system into not seeing those red blood cells, such that if you do deliver shortly thereafter, or if at delivery we find out baby is Rh positive, we give you that medication to prevent your immune system from responding, to prevent a problem later on.
Those are such helpful things that, like, a woman may not go into her appointment expecting. So 28 weeks sounds kind of like another one of those highlighted appointments where there's a lot going on.
Yes.
And then you mentioned that around 30 weeks you start going a little more frequently. Mm-hmm. Like how often?
Usually about every 2 weeks.
Every 2 weeks.
Part of this is to go over symptoms of things that are much more common in the third trimester. You start to feel more cramping. Some patients might have a little bit of spotting. You're thinking about the delivery, so it's a good time to start planning the delivery, talk about preferences during birth. You know, the whole idea of a birth plan is something that I encourage everyone to bring up so that we can talk about it, talk about what's important, what's not important. We check your blood pressure more frequently because we know that high blood pressure problems related to pregnancy are most commonly present in the last 10 weeks of pregnancy.
So very important. Even if you feel like you're just going in and you wait maybe 20 minutes or a half hour for a 5-minute appointment, it's still worth it. And best case scenario, honestly, is having you tell me after 5 minutes that things look good.
Yes.
Right?
Exactly.
I don't want to be there for a long time looking into things because there was a red flag.
I always tell my patients, even though these visits are quick, we get lots of good information. We measure the size of the baby, we hear the heartbeat, we check your blood pressure, we check your weight. Those are all really important things. And so even if you feel well otherwise, we've gotten some really good time.
Yeah. So, what gestational age is full term?
Mm-hmm. So a baby is well done, so to speak, at 39 weeks. 37, when I talk to patients about when they've delivered, we consider a term pregnancy 37 weeks onward. 39 weeks is when we start thinking about, well, can we end the pregnancy because there's no more time, no more benefit to waiting, for example.
Is there an expiration date on the pregnancy?
Most people tend to recommend delivery by 41 weeks. It's universally recommended by 42, although there's a few extra things you got to do in that 41st week. A small number of people make it to 41 weeks, and so it's a less common sort of thing to think about, but usually 41 weeks is when most people will recommend a delivery.
So well done. I love that term for 39 weeks. So a lot of people have questions about induction. Yeah. And as you're nearing that point, those prenatal visits leading up is when you can have a discussion about whether or not you're a good candidate.
Yes.
And who do you consider for an elective induction?
Yeah. So the basic idea is when we think about a delivery or inducing somebody's labor, in the past we did it because we had a good reason to, because the risks of continuing the pregnancy outweighed the benefits of remaining pregnant. For most problems in pregnancy, when we think about inductions, in the past, up till recently, that would come with an indication for delivery before 39 weeks. Okay. Now, when you have patients who make it to 39 weeks, because babies are well grown, the problems of being delivered for babies are at their lowest point. The risk of stillbirth is at the lowest point at about 39 weeks. We can talk about ending the pregnancy because we're ready to be done. We used to think that this increased the rate of C-sections. A trial came out a few years ago that has actually demonstrated that that's not true. And it may even be beneficial to a small number of people. And what that means is if you would like to end the pregnancy 39 weeks to 41 weeks, that it's a thing to talk about.
So you're telling me that I will find out my ultimate due date, my husband can get work off, I get babysitters for my other kids, and I show up and have a baby.
Yes, there are a couple of caveats. The big downside to elective inductions at 39 to 41 weeks is that sometimes they can take more time. They can take more effort, they can be more expensive.
Is this for first-time moms or everyone in general?
For both people, for both types of moms, this is true. First-time moms in general spend more time in labor, or they think their experience tends to be longer than it is for moms who've had babies before. That's just because the body tends to be a little bit more efficient about things. Nevertheless, when you are starting or putting a person into labor, you're doing that before the body chooses to do so. And so you're trying to accelerate a process that oftentimes takes days, if not weeks, at home, sort of silently, than we would see in the hospital.
So you can anticipate a longer delivery, but that's okay. There's not a huge problem with that.
Yeah.
Okay, so I delivered, and I'm going to see you again afterwards at some point. When do those postpartum visits happen? Yeah,
this is something that's changing a little bit. Classically, we think about your postpartum visit, if you had a vaginal delivery, coming back by and seeing us by 6 weeks or so. But we know that 6 weeks is a really long time for lots and lots of changes. You have dramatic changes to how you feel. You have changes to, bleeding, for example, after delivery, what is normal, what's not normal. You're breastfeeding now. You're taking care of not just yourself, but somebody else. And so all of these things that you pay attention to, like diet and exercise, are so much harder. Mm-hmm. I always tell all my patients that I would love to see them by 6 weeks, because if they have any of these problems, at the latest, that's right, I want them to come and see me, even if it's a quick 15-minute visit, to say, is what I'm feeling okay? Or I'm really struggling here. Should I be worried about postpartum depression? Is my bleeding normal? Mm-hmm. I'm having issues with breastfeeding. How do I go about this? I encourage everyone to come and see me at any point in time. Some people, we schedule this appointment right before they go home from the hospital. Some people, I say, come back and see me when you're ready, so that you can fit it into your lifestyle, which is about to dramatically change.
Yeah. I'm hearing you say, it sounds like there's no stupid questions, mm-hmm. and there's no way to know if what you're experiencing is concerning or not without asking.
Right.
So you should never hesitate.
Exactly.
Ever. Whether it's pregnancy or the postpartum period.
Exactly.
So another question that a lot of women have is later on, maybe as a result of having children, or mm-hmm. I'm thinking about birth control and having pelvic floor issues. Maybe I leak a little bit when I'm laughing, coughing, sneezing, jumping on the trampoline with my kids. Mm-hmm. Who do I go to for help with that? Is that also my OB?
Yeah. So that's the sort of gynecology piece of mm-hmm. OBGYN, or the GYN part. Your OBGYN is always a good place to start, at least at first. When it comes to some of these very specific things, when it comes to being a woman or reproductive health, bladder health, those are very easy questions that many gynecologists can address. If we can't, then we'll get you to the right person. And that's an okay thing to expect. A lot of patients don't have a primary care doctor early in life because they spend a lot of time with an OBGYN, and mm-hmm. we do a lot of primary care. And when we don't know the answer, then we will help you get there. We don't have the answers to everything, and I think that's something that that can be daunting at first, both for patients and for providers. But the good news is I would rather have you see me for a problem, for me to say, I don't know the answer to this, but we can get you somewhere that you can.
Yeah, and just opening the door to getting the care someone needs is
exactly.
That makes me feel very reassured and comforted, knowing that a friendly face is somewhere that I can start.
Exactly.
Yeah.
Exactly.
Is there anything else that women and families should know in general about what an OB can do for them, or about pregnancy in general, an ending pearl to leave everyone with?
I think the most important thing to know is to use the time that you have. There is so much that your obstetrician is going to have an opinion about. There's so much that he or she knows, and while they may not necessarily bring it up at every single visit, they still likely have an opinion about it. And mm-hmm. so I always encourage asking questions, thinking about the things that worry you, thinking about the things that you're thinking, I keep hearing this, but I don't know if that's correct or not. Just bring it up, and I'm almost certainly everyone's going to have some sort of opinion on it, and to stay engaged in your care, because that's how you'll get the most out of the knowledge and expertise of the person you're seeing.
I love that. Well, in Intermountain Moms, that's one of the reasons we exist, because people have those non-urgent questions in between, mm-hmm. or maybe received a diagnosis that they'd like to learn a little bit more about. And so we get a lot of questions about morning sickness, or about oh goodness, I could just go on forever. But those are like non-urgent questions where if you Googled
Mm-hmm.
and look for Intermountain Moms, we have a video library on YouTube where chances are we filmed a video with a lot of
Mm-hmm.
information about that in the video. And so hopefully that's a helpful resource to people in between. But I often end up saying, anyway, like, please still ask your OB provider because
Mm-hmm.
they can give you tailored information and advice,
Mm-hmm.
and you know the whole picture, and can give them exactly what they need and tell them about exactly what they have.
Yeah.
Yeah.
Yeah, I think that's great.
And tell everyone again one more time where they can find you.
So you can find me at Riverton Hospital in the Southwich Clinic. Our clinic is on the 3rd floor. I think it's suite 360.
Awesome.
Yeah.
Well, if you guys are looking for an OB provider, he's your guy. Now you have one.
Thanks.
Thank you so much for joining us today, Dr. Knapp. And thank you for joining us today. And of course, if you have questions, you know where to find me. Intermountain Moms on Facebook, Instagram, and YouTube. Have a great day.